Namaste. I, JVN Smritika Chatwal, Assistant Professor in Jyoti Vidyapeeth, Women's University, Jaipur, Faculty of Pharmaceutical Sciences, is here to deliver the lecture on Introduction to Biopharmaceutics. Now, what is biopharmaceutics? This topic is in sixth semester of B Pharm, and the subject is biopharmaceutics and pharmacokinetics. So the term biopharmaceutics is the study of how the physicochemical properties of drug dosage form and route of administration affect the rate and extent of the drug absorption. That is called as biopharmaceutics. Thus, biopharmaceutics involves factors that influence the protection and stability of the drug within the product, the rate of drug release from the product, and the rate of dissolution of drug at the absorption site, and the availability of drug at its site of action. Now, a biopharmaceutic scheme demonstrating the dynamic relationship among the drug, the product, and pharmacological effect. Now, absorption, distribution, metabolism, and excretion all are comes under the study of biopharmaceutics. Now, biopharmaceutics is defined as the study of factors that influence the rate and amount of drug that reaches the systemic circulation and the use of this information to optimize the therapeutic efficacy of the drug products. This field is known as biopharmaceutics, where bioavailability is the main term. Bioavailability is defined as the rate and extent amount of drug absorption. Any alteration in the drug's bioavailability is reflected in its pharmacological effects. The process of movement of drug from its site of administration to systemic circulation is called what? Absorption. And the movement of drug between one compartment and the other, generally blood and the extravascular tissues, is referred to as drug distribution. So there are two terms which I discussed, that is absorption and distribution. They are the main important factors in biopharmaceutics. So now the term elimination is left. Now, what does the term elimination means? Elimination is defined as the process that tends to remove the drug from the body and terminate its action. Elimination occurs by two processes. First one is biotransformation and second one is excretion. In biotransformation, metabolism occurs, which usually inactivates the drug, and in excretion, which is responsible for the exit of drug or metabolites from the body. Now, what is pharmacokinetic? Pharmacokinetic is defined as the study of time course of drug ADME. Now, what is ADME? You may know what is the term ADME means. A is for absorption, D is for distribution, M is for metabolism, and E is for elimination. And their relationship with its therapeutic and toxic effect of drug is known as what? Pharmacokinetic studies. Okay. Now you know all the things about what are the terms that are related to biopharmaceutics. The use of pharmacokinetic principle in optimizing the drug dosage to suit individual patient needs and achieving maximum therapeutic utility is called as clinical pharmacokinetic. Okay, now these terms in ADME process, which are absorption, distribution, metabolism, and excretion, we know once again the absorption is the process by which drug enters the body, that is called as absorption, because this ADME is very important for biopharmaceutics learning. Now, what is distribution? Distribution is dispersion of drugs throughout the fluid and tissues of the body. Now, what is metabolism? Metabolism is irreversible transformation of parent drug compounds into daughter metabolites. Okay, now what is excretion? Excretion is simply the elimination of drug metabolites from the body. Now, how this process occurs. In pharmaceutical phase, drug administration is done. That disintegrates of the dosage form drug and drug dissolve. After drug dissolution, pharmacokinetic phase occurs, in which ADME occurs. In firstly, the drug is absorbed. After that, that is distributed in the body, where some drug is accumulated and some drug goes to active site, other drug goes to metabolism. After that, where metabolites becomes, and the drug is gone for excretion. But some drug goes to active site, where it shows its effect, which is pharmacological effect, and that pharmacological effect is of two types: therapeutic effect and toxic effect also. Many drugs have their side effects, so that side effects is called as toxic effect. Now this active side prolongation and going through their active side to to show their pharmacological effect, this phase is known as pharmacodynamic phase. Okay, now we are going through this. Now, what is absorption of drug? The process of movement of drug from its site of administration to systemic circulation is called as what? Absorption. Now, we discussed the ADME of the ADME process. Now we know all about drug absorption. Now the question arises that what are the mechanism of drug absorption? How the drug is absorbed in the body? What are the main mechanism of absorption? The three broad categories of drug transport mechanism involve transcellular, or which I can say intercellular transport, and second one is paracellular or intercellular transport, and the third one is vesicular transport. Okay, now let's start one by one. What is transcellular, what is paracellular, and what is vesicular? In which transcellular, passive diffusion or carrier mediated transport occurs. In transcellular, the drug molecule absorbed by between the cells, and in paracellular only no carrier mediated transport occurs and no passive diffusion occurs. In paracellular, direct diffusion occurs. In vesicular, the endocytosis process takes place. Okay, now first one is transcellular or intracellular transport. Transcellular or intracellular transport is defined as the passage of drugs across the GI epithelium. It is the most common pathway for drug transport. The three steps involved in transcellular transport of drugs are permeation of GI epithelial cell membrane, a lipoid barrier that is the major obstacle to drug absorption. Movement across the intracellular space, cytosol. Permeation of the lateral or basolateral membrane, that is secondary importance. Now, what is transcellular and intracellular transport? Transport process involves in drug absorption. That involves passive transport process and active transport process. In passive transport process, these transport do not require energy other than that of molecular motions, that is called Brownian motion, to pass through the lipid layer. So there will be no energy needed. And in active transport process, where the word active shows energy uptake. So these transport processes require energy from ATP, adenosine triphosphate. What is ATP? Adenosine triphosphate, to move drug molecules from extracellular to intracellular myelin. Now, what is passive? This is active and passive transport. Now, we come to active transport process. More important process than facilitate diffusion. The driving forces against the concentration gradient or uphill transport. Since the process is uphill, energy is required in the work done by the barrier. As the process requires expenditure of energy, it can be inhibited by metabolic poisons that interfere with energy production. Comparison between active and passive transport. Passive transport process. In passive transport process, it can be further classified in four types. First one is passive diffusion, second one is pore transport, third one is ion pair transport, and the fourth one is facilitated or mediated transport. In passive diffusion, which is also known as non-ionic diffusion, and in which energy is not required, is defined as the difference in the drug concentration on either side of the membrane. So there should be differences in concentration of drug, right? Now absorption of 90% of drugs are done by passive diffusion. So we know active diffusion is only for 10% of drugs where the energy is required. The driving force for this process is the concentration or electrochemical gradient, right? Now, what is pore transport? Also known as convective transport, bulk flow, or filtration. Important in the absorption of low molecular weight, low molecular size, and generally water-soluble drugs through narrow aqueous filled channel or pores in the membrane structure. For example, urea, water, and sugar. The driving force for the passage of the drugs is the hydrostatic or the osmotic pressure difference across the membrane. Now, in ion pair transport, it is another mechanism is able to explain the absorption of drugs in which ionize at all pH conditions. Now, in facilitated or mediated diffusion, we know something is there to facilitate the diffusion. The mechanism involves the driving force is concentration gradient. In this system, no expenditure of energy is involved. Means it is a downhill transport. Therefore, the process is not inhibited by metabolic poisons that interfere with energy production. In active transport process, there are of two types, primary active transport and secondary active transport. In secondary active transport, this process is further divided into two steps, in symport and antiport. In symport, the term denotes a core transport, and in antiport, that is also known as counter transport. Okay. Now, what is paracellular and intracellular transport? Paracellular and intercellular transport is defined as the transport of drugs through the junction between the GI epithelial cells. The pathway is of minor importance in GI in drug absorption. Paracellular transport differs from pore transport in that the former involves transport of drug across epithelium and through the cellular junctions. Whereas in the case of later, the molecules are transferred from outside of the epithelial cell into the cell through pores present in the cell membrane. So this is paracellular and intercellular transport. We have to, the question arises, what is the paracellular intercellular transport and what define biopharmaceutic term and define ADME and define what is biocompatibility, and these terms are very important in this chapter and they can become under any various examinations. Okay, so please note down these terms. Now, the two paracellular transport mechanisms involved in drug absorption are permeation through tight junctions of epithelial cell and persorption. Permeation through tight junctions of epithelial cell. This process basically occurs through openings which are little bigger than the aqueous pores. Compounds such as insulin and cardiac glycosides are taken up by this mechanism. Persorption is permeation of drugs through temporary opening formed by shedding of two neighboring epithelial cells into the lumen. Now, what is vesicular transport? Vesicular or corpuscular transport, which is also called as endocytosis, like active transport. These are also energy dependent processes but involve transport of substances within vesicles into cells. Since the mechanism involves transport across the cell membrane, the process can also be classified as transcellular. Vesicular transport of drugs can be classified into two classes. First one is pinocytosis and the second one is phagocytosis. These pinocytosis and phagocytosis are discussed in previous lectures also, and pinocytosis and phagocytosis is the part of 12th, class 12 for biology students. And what is pinocytosis? Pinocytosis is also known as cell drinking, where uptake of fluid solute occurs. And in phagocytosis, what is phagocytosis means? Cell eating. Absorptive uptake of solid particulates. Okay. Now, we comes to the factors that affect the drug absorption from GIT. What are these factors that affect drug absorption from GIT? Now, what is GIT? The full form of GIT, I think everybody know about the full form of GIT, that is gastrointestinal tract, right? Now, first, the factor which affect the drug absorption from GIT is pharmaceutical factor. That include what? That include factors relating to the physicochemical properties of drug and dosage form characteristics and pharmaceutical ingredient. And second factor is patient related factors that include factors relating to the anatomical, physiological and pathological characteristics of the patient. Right? Now, pharmaceutical factors have physicochemical properties of drug substance in which drug solubility and drugs resolution rate, particle size and effective surface area, polymorphism, amorphism, pseudomorphism, uh, which comes in hydrates or solvates, salt from form of drug, lipophilicity, pKa, which is also known as what? Partition coefficient of the drug, and gastrointestinal pH, drug stability, stereochemical properties, nature of the drug are physicochemical properties of drug substance, and dosage form characteristics and pharmaceutical ingredients, which is also known as pharmacotechnical factors, that are disintegration time, which is applicable for tablets and capsules, dissolution time, manufacturing variables, pharmaceutical ingredients, which are excipients and adjuvants, nature and type of dosage form, product age and storage condition. These are all the characteristics that comes in under pharmaceutical factors. Now, this is for this lecture. So thank you for listening to this lecture. If you have any queries about this lecture, please let me know. Comment below, and please make sure to write down the notes about this, and please write down some important questions as I'm discussing in this lecture, so they can be come under any pharmaceutical examination or pharmacy related exams. So thank you very much.